here's my takeaway. When we're talking about members feeling educated or respected or informed, that's going to look like different things to different people. And so if we've been operating from a perspective of everyone gets spoken to with the exact same language, our position is that that kind of status quo, that guesswork, that one size fits all, it's not going to do what we need our communications to do to get the most out of them. And it's going to start to get rattled by some of those dynamics that we mentioned. We're not going to cut through the noise, and we might not ultimately do what we need to do in order to maintain sort of our financial position and standing. So as not to be too bleak on this, there are so many tools out there that are sort of at the industry's disposal if we just look around a little bit. And there are some great examples here. We'll talk a lot about our A/B testing, but the industry really can take on these challenges by moving into a test and learn mentality versus a, at worst, check the box mentality, or at best, trying to just ask the question of, well, what's the best practice? And we'll mimic that. The practice to really embrace is constant change, is test and learn, and that helps us to stay away from those sort of miss the mark communications. The example that I'll hone in on here, Netflix cites that they do about 250 A/B tests every single year. So every 2 or 3 days, they are getting data back on what is the most resonant when people are experiencing that platform. 100,000 people per test. And I think it's really notable to look at that sample size because it's something that puts it squarely within reach of organizations that have scale like health plans do. But these tiles where, we're seeing 9 different versions of the Stranger Things logo, those are not, like they talk about marquee banners where it just changes over time. These are actually going to be specific to where if you and I both log into our Netflix account today, we're going to be seeing different ones based on data that Netflix has gathered over its testing and then mapping to us, which is going to be the most relevant. These things are out there, and that's not to be looked at as, well, net healthcare is so far behind. I think it really should be looked at as these are robust practices that we can now step into and we can learn from. And that's a big part of where Clarity's work with the member engagement side goes.